I think when I was a student learning about scar tissue, they always told us it was high priority. So if anyone has any big surgical scars, they say from the beginning, you need to address that. And I honestly did not respect this rule very well. Or let's just say I didn't want to believe that this could be such an important factor. So I think I had to have a few clients come in to really show me that this is actually true.
Are you ready to transform your health journey? Welcome to the Holistish Podcast, where science meets holistic wellness to help you take control of your health. I'm Lianne, an osteopath with a background in psychology, athletic therapy, and occupational therapy, here to guide you through practical ways to feel your best without relying solely on doctor visits or prescriptions. Join me each week for deep dives, expert insights, and real-life wellness experiments as we explore the powerful connection between body and mind. Whether you're new to holistic health or just looking for fresh perspectives, you're in the right place. Let's start unlocking your healthiest, happiest self together. This is the Holistish Podcast. Before we dive in, a quick reminder. I'm an osteopath, not a medical doctor, and this podcast is for informational purposes only. The content shared here is based on my personal experience in education in health and holistic wellness. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider with any questions you may have about your own particular situation and your health. Okay, now that we got that out of the way, let's get on with the show.
Welcome back for another episode of the Holistish Podcast. So this week I thought we would talk about high priority culprit in the body, but it's not always so easily detected or identified when a client comes in to see me in clinical practice. And it's not necessarily that you always need this to be checked by an osteopath, but it could play a role in some of your aches and pains without you even realizing it. So what I'm talking about is surgical scars. Now, it's normal for, say, you're a kid, you're running around, you scraped your knee multiple times. That's one kind of scar. And yes, that scar can have a little bit of an impact on, tensions around the area. But what I'm talking about is when you have, say, a surgery that goes deep in your abdomen. We have multiple layers that create our abdominal cavity. We start with the skin, then we go down into fascia, and then we break down into the muscles, more layers of fascia, and then we go down into organs. So when, say, you have an appendicitis and a doctor goes and cuts to get you to your appendix and to remove it, it actually creates a whole layer of scar tissue that goes all the way down to that surgical site. So even though on the outside, once, the surgery's done and you recover, the surgery, especially in this day and age, the surgeons do such amazing things. You may have a little minimal scar on the outside, but on the inside, you can have the whole tension pattern of scar tissue that lead down to the site of where the appendix was removed. So funny enough, people will come to see me sometimes in clinic and they'll tell me, my low back hurts on my right side. You take a history, you find out there's no mechanical issue, you find out there was never any bad falls or traumas. And then finally you get to just asking general health questions and you ask, have there ever been any surgery? And then it'll come up that, yes, I had my appendix removed, but that was a long time ago. I was 8 years old. You can barely see the scar. It's minimal. So people dismiss it like it's not a big deal. And then we get on the therapy table and I start to do my assessment. And more oftentimes than not, the scar comes into play. So what might look like a little minimal scar, once you start following the patterns of tension that scar has underneath the layer of the skin, it actually plays a big role in helping to balance out your pelvis and your low back. So that's just one little brief overview of how scars can play in. How does it do this? Well, it incorporates within its tension the fascia. I believe it was in episode 2 we talked about all the different systems in osteopathy, and the fascial system is a very, very important one. So when there's a cut in your skin, fascia, muscle, all the way down to your surgical site, the fascia ends up all being pulled towards that, and it fans out like almost like a spider's web going from all these different directions. Then the fascia itself can start pulling from the side of the surgical site all the way up to different areas. For some people, they might feel it in their back. They can feel it into their hip. They can feel it up into their shoulder even. And in some cases, you can even feel it all the way up into your neck, and it feels like your neck is being pulled down, and it's very hard to keep an upright posture because of all this tension that's being pulled down into your scar. So most people may think scars are just a cosmetic thing, but in osteopathy, we know it tells a deeper story. So it doesn't only affect necessarily your posture, although your posture is a very important aspect. It can also have an impact on your biomechanics, so how you actually walk and move if there's a lot of tension that's going into affecting certain joints. And it can also, if you want to go deeper, it can even possibly affect organ function, because if there's certain scar patterns that are going across certain organs, it could put extra tension on a whole system and just make things a little less efficient. I would never say it's that a scar would be the cause of a whole bunch of organs to not function well. I'm not saying on their physiological aspect, but it's possible that just on a functional movement and comfort sense, that these scars could have an impact in a certain way or another. So how about I give you guys a few different examples of where I've seen scars becoming quite a significant factor in the story. We can start off with one client who was a woman. I saw her probably early on in the beginning of my practice, and she came to me with a lot of neck pain, and shoulders were really, really rolled forward. So at first I was thinking, okay, bad posture. She works a desk job. She's probably got a few vertebrae off, and we'll address that, and then she'll be good to go. And usually I get good results with that. So I go to assess her. She does have vertebrae off. I correct them. I even back then I took a lot of pride, and I'd crack the vertebrae in a very satisfying way. And I did what I had to do with the neck and the base of skull. I balanced her out at her pelvis, and off she went. And I was really, really proud of myself. But she came back a week later and told me she had good results for a day or two, and then all her pain came back. So my ego was a little bruised, not gonna lie. Usually I get good results with this kind of problem. But then we went deeper, and I realized as I was assessing her yet again, mechanically what I had corrected was okay. She was actually moving better than the last time, but she was starting to have a pull towards the front of her chest. So I asked her, that maybe this didn't come up because, when you go through a medical history, you're asking more about deeper, more pathological medical issues. And one thing I forgot was, have you ever had any aesthetics kind of procedures? And she had, in fact, had breast implants. So there are different ways that over the years that plastic surgeons have done their surgeries in order to have less scars around the breast tissue. Some of them are done through the axilla. I remember I worked in a surgical office, in an aesthetic surgery office for a summer. And back then the whole trend was actually to go through right in your armpit through the axilla and actually go underneath your pectoral muscle. So it actually wasn't just like thinly under your skin. It was actually behind your pectoral muscles. But there's others who do it directly under the skin, and they have scars all under their breast tissue. And this was the case with this client. So she actually had scars that hadn't healed well, and she was even saying, it's true, and I have one implant that just is really, really painful because the scars were more inflamed. So I got to work on just, like we covered up things properly. We did what we had to do to protect privacy. But just under her breast tissue, I started working those scars. And on the side where she did have more pain, the scars were more inflamed. They were more red. They weren't healing as nicely as on the other side. And funny enough, on that same side was where she had more of her upper back and her neck pain. So we did what we could. And then once we release that scar, it's not like you feel the whole miraculous relief once you get off the table from something like that. But as you go about your day over the next few days and you integrate that treatment, she came back to me a couple weeks later and she said, my pain is 75% reduced. And that's pretty significant when you've been carrying around a certain pain and discomfort for so long. So, we did a bit more work on the scars. We found other mechanical issues that popped up. And then all of a sudden, after one more session, she came back, but she said, look, I'm here just to basically update you and tell you that now my pain is gone. And she could actually feel herself standing up straighter. And she even said that her, at one point she had one side that was more painful than the other in her chest, and that pain was gone too. So maybe there were other factors in play, but I like to believe still to this day that the scars were a big factor in her discomfort. And she's come back since to see me, but that issue has never come back. But I did give her some recurring scar massage to keep doing. It's held on quite well. Another client who came to see me, again, this was early on in my career. I think this was a lesson I had to learn early on, because I think when I was a student learning about scar tissue, they always told us it was high priority, one of the top, if not the top. So if anyone has any big surgical scars, they say from the beginning, you need to address that. It's in the top 3. And I honestly did not respect this rule very well. Or let's just say I didn't want to believe that this could be such an important factor. So I think I had to have a few clients come in to really show me that. It's as if the universe is going, no, I'm going to prove to you that this is actually true. So when I was still an intern working in the clinic I work at now, I was working more these random hours where I didn't have I would work late at night. I worked a Saturday. So I was often alone in the clinic and didn't necessarily have anyone to turn to ask for advice. But I had this one person come in. He was a man in his 50s, and he was in such debilitating pain. He said he had such invasive sacroiliac joint pain on his right side. I'll never forget it. And it was creating really intense sciatica pain. So his sciatic nerve was even getting pinched and giving him sciatic nerve pain. So I start assessing him, and I did the interventions I had to do mechanically. I even had a traumatic hip that was pretty significant on him. So he actually had a bad fall where he fell on one side of his sitting bones and it offset his pelvis. So Quick pause for a second. I just wanted to take a moment to say, if this material is resonating with you, I would love for you to come and join my free community over on School. That's SKOOL.com. The group I have is called Ask the Osteopath, and we talk about all different types of topics around your health and well-being. Yes, there's foundations in osteopathy, but we keep it to a broader range all around holistic health and wellness in order to optimize your everyday well-being. So if this sounds like a place you'd like to be, I invite you to go to school.com/osteo. And now, back to the episode. It was like, this is it. That's the pattern. I reset everything. I sent him on his way. I also addressed his nerve pain and helped release certain muscles that were really tight, probably from that imbalance. And I sent him on his way. He calls me 2 days later and he says, it helped, but I'm still in excruciating pain. So now, as a new intern who's trying to prove herself, and I'm going, oh darn, what did I do? I must have done something wrong. Now, I didn't necessarily do anything wrong, but I missed something really important. Kind of like in the last story. I'm sure you can guess where I'm going with this. He had actually had, a couple years prior, an inguinal hernia. So that's when in your groin area, right along the line between your leg and your pelvis, or your bikini line, say, you can have, some people get a hernia where a little piece of your intestine can pop out through little pockets of fascia through into your skin and make a nice little painful pocket, because it's as if it's putting a piece of your intestine on pressure mode and popping through your skin. So he had this inguinal hernia and did the surgery to have a mesh of material that goes to kind of cover that hole so the organ doesn't come and push up through the skin again. And all that went fine, and he was happy with the results of that surgery. But I guess I asked him, like, have you had any kind of surgeries in that area? And that's when it came to him. He's like, yes, I had this inguinal surgery. So I went to work on releasing the tension on that scar, and the amount of tension that was around that whole inguinal surgery, and with the scar tissue from around the mesh, it had so much tension around it, it was giving a whole imbalance to his pelvis. So I worked on that, and then I rearranged his pelvis again with the mechanical stuff, because the mechanical aspect that I corrected last time had all been pulled out of place again. Basically redid the whole treatment I had just done 2 days before, but I did an intense scar tissue intervention before all of it. And that's when he came back a week later and he said, my pain is 5% left. I don't remember exactly the amount of relief he had, but he really said my life has changed since that intervention. So again, it just shows that that time especially, usually in osteopathy, when you're repeating the same treatment and you're not getting the result, like it's always the same thing, that means we're missing something. So if I had just repeated the whole treatment the same, he would have come back with the same symptoms. But because that second time I went to the real source of his problem, of why his pelvis was imbalanced, we were able to get him down with his pain down to 5 or 10%, whatever it was that he reported. And honestly, he came back a few times for a bit of maintenance, but that was really his main issue. And I haven't really seen him since. And that was probably a good 8 years ago that I saw him. So this is where fascia gets really fascinating for people like us in osteopathy. We're talking about whole body compensation patterns that are actually coming from a little surgical site. So in these 2 previous stories, it's just really interesting to see how these are aspects that people may even forget about. Once the surgery's said and done and you don't really think about this problem anymore, that problem is solved. And especially if it's many years ago, people will always tell me, oh, but that was so long ago, that can't mean anything. And that's when I just laugh and go, it's probably your biggest problem. And I can link that in with a lady who came to see me. Again, still, this was early in my practice. I had to learn this lesson very, very early on in my practice, how important the scars are, to the point that now I don't question it as much. But I think these stories stand out to me a lot because back then I didn't believe it yet. So this woman came to me saying her right knee, it was a massive problem. She couldn't walk for many hours. She couldn't do exercise anymore. All she could tolerate was swimming because even going for walks, her knee would always become really inflamed and in pain. In her case, it was pretty quick for me to see because it was summertime. She was wearing a beautiful skirt, whatever, and she just lifts her skirt up to about mid-thigh level. And that's when I look at her knee and I see a massive scar. Very old, but very thick, very tight, and very tense, that was going all along the outer side of her right thigh. And that was all along her IT band. I don't remember why she had the scar. It must have been for either a transplant to rebuild a new ligament. But at the end, I was correcting her knee because she was telling me, I remember she was a nurse, and she said, no, I'm a nurse. I had surgery on that knee. I know it's the knee. So I think I spent multiple sessions just letting her tell me what to do. And I would realign her knee. I would treat her knee. And yeah, there was some scar tissue on the knee. She allowed that. But it was only when I finally put my foot down after a few sessions, because she was getting frustrated saying osteopathy doesn't do anything. And I think I just said, well, maybe if you let me take control for once, maybe, I said it in a much more delicate way than this, but maybe if you let me just work this scar a little bit, maybe we'll get somewhere. So finally I decide after, she egged me on a bit to work that scar. And that's when everything unlocked. But it was really interesting because she actually didn't want me to touch that scar because she didn't want to admit to me, but it was actually a very sensitive scar, and it gave her a lot of discomfort when I worked on it. But that's how much tension was actually being pulled from that scar and unbalancing her knee. So it took us some time to even just get her to be less sensitive about being touched in that area. And bit by bit, we were able to break up a lot of tension in that scar along her IT band. And when I finally got it to a level that was satisfactory, and that actually took a couple more sessions, that's when her knee pain finally started going away. So I tell you these stories to really reinforce the fact that you can't dismiss a surgical scar if you're having discomfort and pain. And I would even say if you don't have any pain but have had a surgery or you have a deep surgical scar, I would highly encourage you to either learn how to do a very thorough scar massage, or I would encourage you to go consult an osteopath who can help you get some of that tension out that may be causing some imbalances that either you don't feel yet or will eventually catch up with you over time. So if this episode resonated with you, I think I'm going to create a video where I can show you how osteopaths actually do this type of scar massage. It won't be long, it'll be maybe 5 minutes, not even, where I'll just show you the techniques with my fingers of how I try to address this kind of scar tension. So if that is of interest to you, I will put a link in the show notes of how you can access that video. And if you already follow me on Instagram, I will put a post where I will invite you to put the word scar in the comments, or you can DM me scar, and I will send you the video link that way. But probably the best bet would be to just follow the show notes first, and I'll link it up in there. So if you have ever had a surgical scar, a deep one, or one that has passed the surface level of the skin, please check out that link, because I will help you try to start getting some tension off that we can get you some relief. All right, have a wonderful week, and I'll talk to you guys soon.
Thank you for being a part of today's episode of the Holistish podcast. Ready to take your wellness journey further? Visit Holistish, that's holistic with an SH at the end, .com, to access our latest resources and wellness tools designed to support your holistic health journey. For holistic health inspiration and a behind-the-scenes look at integrating traditional wisdom with modern wellness, join our growing community on Instagram at the.holistish. If today's episode resonated with you, subscribe so that you never miss out on our weekly episodes, and leave a quick review to help other wellness seekers find us. Until next time, stay curious, stay balanced, and keep exploring what works best for your unique body and mind. Your health journey matters, and I'll meet you right back here next week.